Ankur, who is from the University of Cambridge, and he's going to talk about the overall implications of SARS-CoV-2 variant vaccine developments for innovation and treatment in the future. So over to you, Ankur.
Thanks, Sheila, and I'd like to thank the organizers as well for having me on this Policy Lates session. So I'm gonna, I think I couldn't talk better than the previous two speakers on the science side. So I'm going to give a little bit of a snapshot on what sort of lessons and opportunities have come about from this COVID-19 pandemic, both in context of global health. So as Teresa mentioned, I work at the University of Cambridge. I lead a group in global health. We've been working on outbreak surveillance for several diseases for several years, and we've learned lessons from those surveillance that have guided vaccines and diagnostics and outbreak response. So I think I want to point out to the COVID-19 pandemic's awareness and education drive in a way. What's happened is the things that we couldn't make people aware of, and the things that we couldn't educate people about, COVID-19 has really allowed us to do that. And what I mean by that is the government and general public setup. Generally, it's very difficult to get any message across, any scientific message across, and what COVID-19 has really done is it has educated a lot of the people who would otherwise be ignorant of the things that we as infectious disease scientists and clinicians do. Oops. And what I mean by saying that is things like pathogen. A few years ago, we published an article, and someone from the general audience asked us a question: what exactly is a pathogen? So what COVID-19 has really clarified is what a pathogen is, and how pathogen causes infection is something, again, we've understood very well in COVID, to establish the ways we've gone about making vaccines. And then infection can also be either asymptomatic or symptomatic, in which case, in symptomatic, if it is symptomatic, it would be a disease. So the difference between infection and disease is, again, something not many people appreciated before COVID-19. Now people do. And when there is a cluster of these disease individuals, then it is called as an outbreak, and then all the public health response kicks in. So this is, again, it's been an educational journey for governments, for several communities, and for people around the world, how pathogen to outbreak journey really takes place. Now, we've all heard that vaccines are the best possible tools available to the mankind at the moment to protect outbreaks from further spreading, and to protect the general population from getting the infection in some cases, but mostly protect from disease. But it's inevitable that there would be some vaccinees or some recipients of the vaccines who would not respond as well, would not be able to mount the immune response despite being vaccinated. So therefore, treatment options have to be absolutely worked in parallel. And then diagnostics, again, COVID-19 has reminded how important diagnostic setup is, which until before COVID-19, a lot of diseases that we worked on, we found out, especially in low and middle income countries, most of the treatment or any kind of advice was given. It was empirical advice, so just based on symptoms without really diagnosing what exactly the problem is. So COVID-19 has highlighted what the importance of diagnosis is. And then surveillance. A lot of people initially, when the COGS UK consortium was set up, doubted the relevance of that surveillance system because vaccines were already being made. But now we've come across these variants that seem to be, trying their best to evade vaccine response, and therefore it again highlights how important genomic-based surveillance, so state-of-art surveillance, is and continues to be and will continue to be going forward as well. So in a way, this journey from COVID-19 pandemic so far has really been almost like a fast-track diploma in understanding how from pathogen to outbreak and how you go about making vaccines and treatments and diagnostics, all of that in a very short frame of time, and then how to continue with the surveillance to assure that we always remain ahead of the virus. The other thing I thought I'll highlight in this presentation is the importance of clean water, sanitation, and hygiene. Now, to most of us, this may just sound not really relevant here, but you'd be surprised how many people die. Millions of people die because of diseases that are caused due to lack of sanitation and hygiene and clean water. What has happened because of COVID is, I see that as a lesson and also as an opportunity, is that the message of maintaining the overall cleanliness, having adequate sanitation and proper hygiene has really, we've been able to send that message out to really far-flung places, to really remote places as well, which was previously deemed impossible. And therefore, we always thought that vaccines are the only way we can protect some of the communities that are really rural or that are not really well educated. But what COVID has done is it has taught us really that message of clean water, sanitation, and hygiene, which is WASH, in which United Nations and WHO have been really toiling for several decades now, just to improve the overall infectious disease landscape in so many countries. And I hope with COVID-19, since people are managing their sanitation and hygiene much better, we'll be able to sustain that practice and able to make the best use of that opportunity in global health context. Then the other thing that has become very clear from this pandemic is the importance of proper communication. How government talks to its citizens when there is a public health emergency to ensure that there is best compliance from the people. And also how government and public health agencies tackle any miscommunication that may lead to things such as vaccine hesitancy. Or what kind of digital health channels could be built quickly, such as the track and trace system, and how quickly they could be deployed to the general public setup, so that they start to become useful right from early on in an outbreak situation. And so for all of that, the importance of proper communication is something that has to be a lesson that we have learned from this pandemic. Then, since we've been talking about pandemic here, remembering that it's a situation that is affecting the whole world as one, the importance of equitable access is absolutely something that COVID-19 pandemic has highlighted. Now, when I talk about equitable access, most people tend to think about equitable access of vaccines. In this slide also, you see most of the world that is in red shade, which means that less than 10% of their population has been vaccinated by at least even one dose of coronavirus vaccine. So this kind of shows that we're still very far from WHO declaring COVID-19 pandemic as over, considering that 130 countries of the world are still, to receive even a single dose of coronavirus vaccine. So equitable access of vaccines, equitable access of capacity, of skill set, of training, of diagnostic tests, of surveillance setups, everything has to be ensured going forward. So it's been a huge lesson that we've learned from COVID-19. Now, one other opportunity that COVID-19 has given us is everyone has suddenly woken up to other problems as well, because we've struggled so much in this pandemic that governments have realized that there are other problems that we might face and that might trouble us going forward. So let's try and sort them out now, or try and do something about them now, or attend to them better. And one of them is antimicrobial resistance. Sheila mentioned that there has been already a session on AMR, and I can see already in various forums that AMR, stronger attention is being given to AMR because it's being pitched as a slow but bigger pandemic that needs attention. And so I hope COVID-19 has really highlighted other problems that are out there in the world, and actually more dangerous than COVID, which only has roughly 2% mortality, exist, and those problems need urgent attention. And one of them is AMR. And with all of those opportunities, I think it's easier said than done that government should take care of all of those things. But I think it's actually not that difficult, considering now the whole world has a refurbished diagnostic landscape. The RT-PCR machines have reached to very remote places, remote parts of the world as well. And people have been quickly trained, so the skill set has been developed, capacity has been developed, infrastructure has been built in very remote places where previously you would never even think of diagnosing a problem and then trying to tackle that problem based on that diagnosis. So I'm really hoping that this refurbished landscape would be put to use for all the other problems that exist in all the other parts of the world, so that anything that has a potential epidemic and pandemic potential is attended to properly. And then there are new vaccine technologies that have become available, mRNA vaccine technology that previously struggled to make way into even into a regulatory office, has gone through and showcased how successful it has been. I think this is an example how there might be some other technologies that need better attention and a little bit of risk taking, of course, while maintaining that all the safety in clinical trial is taken care. And I think we can do all of that very, we shouldn't say very easily, but I feel confident we can do that, considering that we have been absolutely ultra fast in COVID-19. We've developed safe vaccines and deployed them, more importantly, in less than a year. Making vaccines is one thing, but vaccinating population is a different, completely different challenge. And it seems that several countries have done that pretty successfully. And I think the lesson is that we learn from that and ensure that some of the things that are out there that are endemic in countries are attended, so that there is enough response or enough preparedness that those endemic diseases don't end up becoming epidemics. So that baseline level of diseases in some parts or in some countries has to be given increased attention so that they don't end up becoming epidemic. But I'm sure it's practically it's not going to be impermeable. So therefore, in case things do end up becoming epidemic within a particular country or within a couple of neighboring countries, the second layer of response has to come in so that those epidemic flare-ups don't end up becoming a pandemic and we don't see a situation similar to what we're seeing now. So I think the lesson for us really is emergency preparedness, but the opportunity is that we've done a lot in COVID-19 that could be used going forward to tackle so many other problems that were previously ignored and therefore make a contribution towards a better global health landscape. That's all from me. Thanks very much.
Thank you very much. Some fascinating points brought out there. I just think it's amazing that, okay, we've had a year's worth of pandemic, which has been awful, but for scientists, I think it's great to realize that science is so much in the media at the moment and that the general public are learning a lot. I mean, the average man in the street probably knows about PCR. They might not know what PCR is, but they will have heard about it.
Yeah.
And that's another opportunity that we could possibly take forward in the future. Hopefully not with a pandemic underlying it. But so what are your thoughts on that?
I think absolutely. I think PCR is still quite an advanced term. When I talked about the word pathogen, not many people actually knew what a pathogen means. You talk about bacteria, you talk about virus, they'd understand, but not really about the pathogen and infectious disease landscape. And in fact, how exactly vaccines work, how important those are. I think we've been taking childhood vaccination as a casual thing now, and I think people have started appreciating how important and how valuable it is that we've got vaccines against so many diseases that a child gets early on in his or her life, and therefore they're able to go on and live a long, healthy life. So I think it has been an eye opener, but at the same time, very positive things have also come out, and they would remain positive only if we could sustain them.
And I guess that's the challenge, sustaining that interest from the general public. So I guess we scientists have to work harder at that in some way.